All right, for the next item, we have our traditional Health and Safety Committee report from our School Health Committee, and Dr. Tigan's going to come forth to provide you that update and take any questions that you may have.
Good afternoon, Chairman Cooper, members of the board, and Dr. Cashwell. I'll jump right in as I know we have a long agenda today.
Can you lift the mic up, please? Thank you.
Yes, sir.
Thank you, ma'am.
At the last two meetings of the Henrico County Public Schools Health Committee, the following topics were covered: reviewing the most recent data and comparing last week's student and teacher attendance data to the baseline, providing an update on the status of contact tracing and current case levels, sharing the status of vaccines for staff and students and the potential of testing students at school, defining school volunteer guidelines, and finally, revisiting the conversation about the use of playgrounds at the elementary level. Let's begin with a look at the most current core indicators as well as the secondary criteria. On March 10th, the total number of new cases per 100,000 persons within the 7 days was 116.3, just to take you back to the previous meeting. And the percentage of PCR tests that were positive during the 7 days was 4.6%. 4 weeks later, as of Wednesday of this week, 2 weeks past our recent holidays, the number of new cases per 100,000 persons has increased to 138.5, and the percent positivity is up to 5.2%. Thus, the community transmission level remains at the highest level. Those numbers, I will say, have been trending down for the last week or so. And as a reminder, the level of impact resulting from the secondary criteria are shown in this table above. And the secondary indicators are the transmission within school, student absenteeism, and staff capacity. While Mrs. Gilbert will discuss transmission within schools a little later in the presentation, the number of outbreaks since February 22nd were, as you may recall, 2 confirmed and 2 pending at the last meeting, and the number of outbreaks is now 4. And so the 2 that were pending did convert to outbreaks as we suspected at the last meeting. But there have not been any additional outbreaks. The attendance numbers for students learning in person last week were calculated and compared to the baseline set the week prior to the March 25th meeting. There are no significant differences. The average attendance rate for all students was at 92.3%, which is actually up 0.1%. We saw a slight decrease at elementary and increases at both middle and high schools. When looking at our staff capacity, on average, there were 2.3 teachers absent from each school each day last week. This is slightly up from the 2.1 average that was the baseline that was set at the March 25th meeting. But I'd also like to note that the ability to acquire substitutes remains high and has actually gone up slightly, thereby indicating that our staff capacity is still strong. Mrs. Gilbert will now provide a status report on contact tracing, vaccination efforts, and potential on-site COVID testing.
Chairman Cooper, members of the board, Dr. Cashwell, good afternoon. We continue to see an increase on number of students testing positive for COVID-19. This trend, associated with a decrease in positive adult cases, appears to be related to our successful effort here in HCPS to offer and vaccinate approximately 75% of our workforce. Despite the student trend up, our prevention strategies have continued to hold the number of exposures to a lower number. Our contact tracing staff is now working closely with staff reporting their vaccination status to minimize the quarantine time if an exposure should occur. This is allowing an earlier return to work date. In addition, our students are now eligible at 16 years of age and over to receive our Pfizer vaccine. Once fully vaccinated, which is receiving the full vaccination and 2 weeks post your last shot, contact tracing and the school nurses will use the same guideline to get our vaccinated students back into instruction face-to-face more quickly. While there has been a short pause in the registration process at the end of last week, the VDH registration system became operational again on Tuesday of this week. Very happy faces around my office. As such, HCPS continues to offer newly hired staff the ability to be vaccinated. The volume of vaccinations has steadily declined as most staff have either received the vaccination or declined to pass that opportunity to be vaccinated. In addition to staff, there has been an effort to communicate with students 16 years and over, with or without extenuating health issues now. As of this past week, we have opened up to all 16-year-olds, not just those with those chronic conditions. They are again eligible for the Pfizer vaccine. This is a change, as we said, from 3 weeks ago when those individuals 16 and 17 had to have that underlying health condition to receive the vaccination. Our communications and community engagement team has worked to communicate this updated access for vaccination as well as those criteria I just described. We would like to offer them a thanks for doing that. The VDH has also shared that anyone 16 or older can sign up at many local pharmacies to receive the vaccination, and this may be more convenient to some of our families since the mass immunization clinic is at the Richmond Raceway. The Virginia Department of Education is also offering school divisions the ability to test our students and/or staff for COVID-19 at the school. Testing at the school could help with early detection to prevent greater transmission. The Health Committee had a robust discussion around when to test, the accuracy of said testing being that these are rapid tests, and the areas of greatest need for testing. At this time, the group left the meeting with more questions than our current answers, and we are continuing to aggressively pursue that opportunity for our district. Members of the committee are doing research and will continue to do that and report back at our upcoming meeting. Dr. Tigan will now update our school district on volunteers for schools and our playground usage.
As we know, school volunteers play a significant role in many of our schools. A school volunteer is a parent, a family member, senior citizen, or community partner who chooses to donate time to support some aspect of the school experience. People who would like to volunteer must apply, be screened, and complete an orientation that includes school guidelines and safety protocols at the school. In keeping with our health plan, the volunteer program will be implemented in 3 tiers, beginning with Tier 1, with progression to other tiers upon guidance from the Health Committee and the division leadership team. Volunteers will be required to complete a health screening, including a temperature check, before being allowed entry, as well as they must wear a multi-layered cloth covering and practice social distancing at all times. The principal and volunteer coordinator at the school will know which tier level the division is currently in, and it will be at the discretion of the principal to determine whether or not the school will implement that tier level. Tier 1, just to define each tier, the volunteers may work outside. Tier 2, in addition to working outside, volunteers may make copies or work at the front desk, sitting or standing at least 6 feet from others. Volunteers will not be permitted to work in classrooms, the cafeteria, or gym. This also includes any volunteering after instructional hours. For Tier 3, volunteers may volunteer in the classrooms, cafeteria, and gym. They may work in proximity to students and staff as long as they wear a mask and practice social distancing. While the preliminary work of the volunteer work group has been completed, the Health Committee needs to define the criteria of moving from Tier 1, where we are now, to Tier 2 and then Tier 3. This work is slated for Monday's Health Committee meeting, and once defined, this information will be shared with the leadership team for consideration. And lastly, I would like to circle back to the question asked at the March 25th school board meeting concerning the use of playground structures at the elementary school level. The leadership team reviewed the request, and the Health Committee then reviewed the current CDC recommendations for playgrounds. That CDC recommendation for playgrounds is if playground equipment must be used, it requires normal routine cleaning, including high-touch surfaces made of plastic or metal, such as grab bars, play structures, and railings. After much discussion, it has been decided the elementary playgrounds can be used by our students. It is the discretion of the principal to determine the cleaning of the equipment and structures, what that schedule is, and the administrators can use their discretion for using volunteers outside the building or having staff complete those routine processes. And the Health Committee continues to meet weekly to review not only data, but practices, and have the conversations around transitions. As more and more data becomes available, the recommended actions are likely to shift. And having key members from the Virginia Department of Health at these weekly health committee meetings helps us stay or adjust our course as we continue to put our safety of staff and students a top priority. And Ms. Gilbert and I are happy to answer any questions you may have.
Thank you. Thank you as always, Dr. Tigan, for your report, as well as Ms. Gilbert for your hard work. Ms. Atkins, do you have anything?
I do, thank you. Could we please share the vacancies that we have, if you have that number readily available?
Yes.
For clinical aides, et cetera?
Ms. Atkins, I currently have 2 open nursing positions with 2 anticipated retirements for school year 21 and 22, and I have 19 clinic aide positions open.
Thank you. That's all I have.
Ms. Ogburn?
Nothing for me, thank you.
Thank you. Ms. Shea?
Thank you, Reverend Cooper. So Dr. Tigan, you know my typical question at every meeting, and I think you already answered it in the presentation, but my typical question is, how many transmissions have we had or outbreaks? And so that's now 4 confirmed, correct? Yes. And then the follow-up is, where in our schools are these occurring? And if I remember from the last board meeting, it was 3 on school buses and 1 from classroom. Is that correct?
Yes, ma'am, Ms. Shea, that is correct. We also have 3 pending cases out there now as of today, and that's new information from the health department meeting this morning. One, I am unclear at this point what that is, just because I got that information late to this meeting. The other 2 will be an additional bus case, also transportation, and then sports related.
You know, I think this is, I appreciate y'all humoring my asking this question at every single meeting, but I think it's so important because it really does illustrate how effective our mitigation strategies are in the building and in the classrooms.
Yes, ma'am.
And so I think that's an important part of this story to continue to tell, not just looking at cases and quarantine numbers, but the transmission in our schools. And the fact is that it's very, very, very low. And then I just want to take a moment actually to thank all of our families who over spring break engaged in safe practices and engaged in safe practices when they returned, so that while we did see a little bit of an increase, we didn't see a huge spike in cases. And then lastly, a question about the testing of students and staff. So I know you said you left with more questions than you entered with, so this may be something that's still pending. But just for my understanding, are we looking more to utilize these rapid tests at school for suspected cases, or more like some of the higher education institutions did with random testing?
So those are both of the options out there, one of which is screening. So a particular lot of students or employees would be repeatedly tested over a period of time, 4 to 8 weeks, so that you consistently get results and can see that that person or that group of individuals is continuing to be negative. That would be something like your sports arenas, which we've seen in our college as well as their professional venues. The other one is to use, as you said, in the illness or symptom category, so potentially for our students or even staff who present with COVID-like symptoms while they're at school.
Let me put a qualifier in there, though, too. We have to have parental permission
Yes.
to be able to test students.
Yeah, that was going to be my other question.
Don't want any parent thinking we're just going to randomly test their students.
Exactly. So, and parental consent would be one of those questions that we came away with that we're working through to make a presentation back to the health committee.
Perfect. That's what Dr. Tigan said is where I was headed, just to ensure that we make sure that we have parental consent and that we're all working together as a team. So I appreciate that. Keep up the really great work, hard work, vaccinating and mitigating and getting us through it. So thank you both.
You're welcome.
Thank you, Ms. Shea. Mrs. Kinsella.
Yes, thank you. I just have, I've been hearing from folks in terms of the student vaccination and who will make the decision as to whether or not the vaccination for students will be required. Who makes that decision, Dr. Tigan?
I would say that would be that are all other vaccines, it's a state level decision. It's in state code. So
Okay.
that's not a decision that we would make as a system.
So just to repeat that, your school board and division leadership do not make that decision. Thank you very much for that. And then if you could please clarify for me, did you say that the 3-tier volunteer system may or may not be implemented at a school based on principal discretion, or that it was principal discretion as to how it was implemented?
It's principal discretion on whether they can accept volunteers in certain situations. So we may be in tier 2, but a principal may indicate that that's in non-student spaces, and they may say that with the proximity and the office area or places they would work, that they can't accept additional volunteers because they would not be social distancing. And so there could be reasons why, but it's,
So principal discretion, just like in other buildings where capacity,
Yes.
where we may have a larger number
Absolutely.
of students in a building, that kind of example. So that's the kind of principal discretion we're talking about.
Yes, ma'am.
Okay, it may, similar guidance, but it may look different across schools just because of feasibility in certain schools.
correct.
Thank you.
You're welcome.
That's all.
Thank you so much, Ms. Kinsella. Again, thank you all for the data and for the presentation. Dr. Catchwell.
All right, thanks again to our health committee.